everyone, my name is Kari. I will be demonstrating a cranial nerve exam today. For demonstration purposes, I will be having my husband fulfill the patient role for today. Happy Super Bowl Sunday! So first you would normally test the cranial nerve 1, which is the sensory for smell. So you would normally have them smell something that is very strong scented, like coffee, a soap bar, peppermint, spearmint. But for demonstration purposes today, we will not be doing that. So we would be moving on to cranial nerve 2. Cranial nerve 2 is we're checking for our visual acuity and our visual confrontation. Okay, so by demonstrating this, I am going to have him close one eye, and I am going to close the same one, so both eyes are going to be closed at the same time. I'm going to wiggle my fingers in the peripheral vision area. All right, and he's going to let me know when he can see my fingers wiggling, and that will kind of test his peripheral vision. All right, so close your eye. I'm going to close my same eye.
I can see it. I can see it.
I'm just trying to...
I can see it. Yeah, I can see it.
All right, perfect. Good job. All right, you passed.
Thanks.
All right, so then for the next one, I would have him do the eye exam chart, the Stenin chart. I would be having him stand 20 feet away, and he would be reading the lowest line that he could. This would be testing for his 20/20 vision, or whatever his vision acuity would be. If he failed and did not pass the lowest line, I would have him move up to the next line to see for his vision acuity exam. If you miss more than 3, you failed, and you just need to go up to the next line. If he was able to read the 20/20 line, we can have him go down to the next line to see if he was able to see further than what most people are able to. But for this, with him not wearing any glasses or any contacts, for right now, he has 20/20 vision. If he had glasses or contacts, I would have him wear his glasses or contacts, and we would do the exam, and then we would note that he has contacts or glasses on. All right, so for this purpose, cranial nerve 2 is intact. Next, we would be moving on to cranial nerve 3, which is the ocular motor. And it is a mixed sensation of both sensory and motor. We will be checking the 6 fields of the EOM by doing the star gaze pattern or the starburst pattern. You can also do the H pattern if you choose to as well. But from my preference, I'm just going to use the star pattern and having him check that. All right, so let's do that. So I'm gonna just look straight at me, and then you're gonna follow my finger, okay? So wherever my finger goes, you go, but keep your head still, okay?
Okay.
All right, perfect. He moves his eyes in symmetry through the whole entire process. His eyes weren't moving back and forth or anything like that. So that was a very good thing. So we were checking for neospasms to seeing whether if they were present or absent. And in his case, he did not have that. So then next we will be checking for pleural. So I am going to be shining the eyes into his eyes and making sure that they both constrict when I'm shining the light in there. even when I'm placing my hands in front and making sure both eyes do the exact same thing, even without that direct light. So first we're going to do the direct. All right, good. And then now we're going to do the indirect. All right, good. So what I was doing there is when I was shining light in this eye, I was looking at this eye, making sure that it was doing the exact same thing as this eye. Because even when they're indirect, you want to make sure that you still have that. And then next we will also be demonstrating cranial nerve 4, which is the abductus. And we're making sure that when he's looking at my finger, his eyes go downward and inward. All right, perfect, which he did pass. So cranial nerve 3 and 4 are both intact. So next we will be moving on to our cranial nerve 5, which is a mix of motions of sensory and motor. So for this, I'm going to check for his strength against resistance, and I'm going to have him move his jaw down as I'm holding it closed, and then I'm going to have him close his jaw as I'm holding it down. And this will just check against resistance. All right, try to close your jaw, and then try to open, or opposite, I'm sorry. All right, try to open your jaw. All right, good. Open it, and then try to close it. All right, there we go. So he passed that one. Next we would test for the sensory portion for cranial nerve 5, but for demonstration purposes for today, we will not be participating in that. But normally you just grab like a little long Q-tip or a cotton ball, and you would touch on both sides of the face, it's making sure that he can sense both sensations on all different spots, making sure that they're symmetric, which would be testing for the face, the scalp, and testing on the mandible area as well. And then for the corneas, we would be searching for the sensation of tears. So you'd grab and you'd wind it all up into like a little tight little knot, and then dab like the cornea on each eye, making sure that they would get the tear response. That's what you would be looking for. And then you'd be looking for saliva for the mucous membrane part by giving them something sour to taste, and then making sure that they have that drooly sensation. But for demonstration purposes today, we will be not participating in that. So cranial nerve 5 is intact. For cranial nerve 6, which is the abductus, which is a motor for lateral movement of the eye, we already tested this when we tested for the EOM for cranial nerve 3. So cranial nerve 6 is intact. Next, we will be moving on to the cranial nerve 7, which is our facial, which is a mix both of motor and sensory. So for cranial nerve 7, I would ask him, can you do the chewing movement for me? Perfect, great job, thank you. And then I would say a 2-syllable word and have him repeat that, and I would be making sure that he's pronouncing it and moving his face in symmetry. So can you say football?
Football. Can
you say Sunday?
Sunday.
Okay, perfect. He passed. Good job. And then can you smile? All right, lift up your eyebrows. Frown for me. Good job. And then can you puff up your cheeks like you have some air? Good. All right, so all the movements were very symmetrical. So cranial nerve 7 is intact. Oh, also too for cranial nerve 7, we would taste for something sweet, salty, and sour on the tongue and have them state whether if it was like sweet, salty, or sour. But we're not going to test for that today. And then we would test like the cotton ball. Oh, that was I already said that. Okay. And then for number 8, for the acoustic, I am doing the whisper test, and then I am just going to plug his ear canal with my fingertip, and then I'm going to whisper a 2-syllable word while the other ear is unplugged to see what he heard.
Football.
Good.
Sunday.
All right, good. He passed. The hearing is intact bilateral per the whisper test. The equilibrium test is not going to be demonstrated today. That's going to be demonstrated in our head-to-toe assessment that we will be participating in later on in this class. So cranial nerve 8 is intact. Cranial nerve 9, we will be testing for it's both a motor sensation and sensory sensation. We're going to be testing for kind of like the gag reflex. So I'm going to have the patient say ah. Say ah. All right, wonderful. And then you can choose with like a gloved finger to test like the gag reflex by like sticking your finger in there and then having him have the gag reflex. But I'm not going to do that for today's demonstration. You're welcome. And then I'm going to have him swallow, and I'm going to feel the sensation. So when he does swallow, I'm just going to make sure that my hands are placed on the trachea in the esophageal area, making sure that I can feel the swallowing sensation. Perfect. All right, so that was for part of cranial nerve 10 is for the vagus nerve is for the swallowing sensation. So cranial nerve 9 was intact when I had him do the ah, and if he were to do the gag reflex. Cranial nerve 10 is the vagus nerve, and then that was like for the swallowing when I placed my hand on the tracheal area and had him swallow, and I was able to feel. Can you state your name for me and your birth date?
Nicholas Aaron Corden, April 9th, 1980.
Perfect, thank you. So he was able to state his name and his birth date, and then there's no hoarseness in his speech as he was speaking. So cranial nerve 10 is intact. We'll move to cranial nerve 11 for the spinal accessory. And then for this one is like a motor test. We are doing like a head movement side to side, up and down, and the shoulder shrug against resistance. All right, so move your head against my hand. Perfect. All right, wonderful. So cranial nerve 11 is intact. Oh, and then we're going to have him do the shoulders. Perfect. Cranial nerve 12 is the hypoglossal cranial nerve, and that is a motor nerve. We are going to have him stick out his tongue and move it from side to side, and we're just making sure everything is symmetrical and his tongue isn't favoring either side. All right, so stick out your tongue and then move it side to side. All right, perfect. So a cranial nerve 12 is intact. Thank you so much for participating in this with me, and hope to see you again. Bye.